So I have nominated Claire Maxwell, who has two roles. Her first is as Leadership Development Facilitator at Newcastle upon Tyne Hospitals, and her second role is as Degree Programme Director of Clinical Leadership at Newcastle University. And in both of those roles, Claire's a fantastic role model. So Claire's a fantastic, authentic leader. It's her values that she really holds close to her that shines through her interactions with her students and her peers. She's one of the most genuine yet honest people you'll meet, and isn't afraid to hold people accountable but supportively challenge them as well. And by doing that and being a role model, she's developing people all the time, and will go that extra mile for you or to help develop you. So there's numerous things I could tell you that Claire's done to deserve this nomination, but two specific ones that pop up in my mind is firstly within Newcastle upon Tyne Hospitals, she's embedded a leadership alumni which brings together leaders and clinicians from all different departments in the trust, and we get to share ideas, share information, look at leadership dilemmas and leadership success stories, and that really embeds that leadership culture and positive culture from the board to the ward. And it's a great networking opportunity and encourages a lot of collaborative system leadership. Secondly, on the clinical leadership module course that she runs, she introduces her students to techniques and skills such as mindfulness and coaching, and things that your day-to-day clinician might not be able to access. So by giving students that skill set, they can develop themselves but also their teams back in the workplace, and evidence shows that that has a brilliant impact on patient care. And Claire's really been the person to thank for that within the region through the clinicians she's had on her programme.
I nominated Sarah and Jenny. They've taken some really valuable work from the healthcare leadership model and mapped it to roles for psychologists. They did it because they'd done some previous work based on the leadership qualities framework, and they didn't want to lose that hard work that they'd previously done. And they wanted to make sure that psychologists had a clear framework for understanding what was expected of them in their roles in CHUV. We've been doing some work in CHUV to think about how clinical leaders could really influence the care that we deliver. And as part of that, psychologists have a really essential role in the clinical team. So those psychologists been really understanding of what was expected of them will really hopefully influence care in the future. They did it because they really wanted to understand how they could influence service improvement and clinical care. So by understanding their strengths and weaknesses, that they could provide better leadership within the clinical team. I think this could be used really widely. It could apply to other professional roles, and it could apply to other organisations. It's a really simple idea, but it's been really well thought through, so it's really easy to adopt and adapt to different roles and organisations. It could be much bigger than CHUV.
I nominated Dr. Chris Tiplady, who is the Regional Clinical Advisor for Health Education North East. Chris is very enthusiastic and passionate about leadership and building skills that will help people perform better as doctors who work across our region. He's worked collaboratively on a number of settings and is always available to offer one-to-one coaching advice and support to trainees in any circumstances. Chris has worked collaboratively across the region on a number of issues, but the two key things that he's done recently is working with the North East Leadership Academy. He has developed a new leadership programme that is available to all trainees, and it really gives them the first steps onto that leadership development role, because they are going to be the future leaders of the NHS. The other thing that Chris has developed is a coaching network, which has been, again, working closely with the Leadership Academy, setting people up on coaching qualifications, which then builds the network to allow support for doctors and other trainees across the region when they're experiencing difficulty either in the workplace or in personal life. Chris has also developed the concept of the pyramids of Heaney, and these are where we've identified the key skills that a trainee needs, which is the base of the pyramid, and then for the sides of the pyramid there is some development work that we're currently undertaking on leadership, research and education and training, and depending on the particular interest of the trainee, they can then select which sides of the pyramid that they want to access. These are added benefits for trainees who come to our region and will hopefully support the initiative of attracting higher volumes of trainees to our North East region.